Thank you. Well, good morning, everyone. Thanks for the honor of presenting as the patient voice today. As you know, I'm Susan Strong, Director of Patient Engagement for Heart Valve Voice. I'm also an American Heart Association Heart Valve Ambassador, a PCORI Ambassador, a research advocate, and I also provide patient support through my own organization, Strong Heart Now. And we can go ahead and start the slide presentation. So for the next few minutes, I'm going to be, next slide, please. For the next few minutes, I'm going to be sharing my thoughts about engaging older adults in this era of COVID-19 and beyond. And one of the questions that has come up frequently in the last couple of days is, what exactly does it look like to be 65 and older? And you might be looking at me and thinking, do I fit in that? Am I one of those patients? And chronologically, I don't, but because of my medical history, I actually have quite a few issues that fall within that group. But other things to think about of what does it look like to be 65 or older? Can we make this just one group? You know, are your patients working or retired? Are they fit or are they experiencing failing health? Do they have social support or are they isolated? What are they living with skin color, economic status? Is English a second language? All of these things we need to be looking at. And we want to get as big of a variety of these types of patients as we can in our clinical trials. So next slide, please. Are the slides showing? I'm seeing myself.
Not yet.
Okay.
We're having some problems. I don't know.
On here soon.
There we go.
Okay. So if we could advance, yep, okay, one more slide. Stay there. Stay there, please. Don't click them all. Thanks. So before we get fully into the presentation, I want to give you a really quick summary of my background. I've been a practicing patient for 37 years now, starting when I was 17 and diagnosed with Hodgkin's lymphoma in 1983. And there's a picture of that. And next click, please. And then in 2014, I was diagnosed with severe aortic stenosis and had a procedure that was just only FDA approved for high-risk patients. You can click one more time. It's called transcatheter aortic valve replacement. So my aortic valve was replaced in 2014. I found out that that was a direct result from radiation treatment, full mantle radiation treatment that I received in 1983. Then next click, please. And then got another surprise in 2017, discovered that I had HER2 positive invasive breast cancer, again, as a result of the mantle radiation treatment I received in 1983. One more click. But today, one more click. I'm grateful. I'm grateful to be a retired educator and have the opportunity to educate from my passion and help patients and also help the medical community help patients. And I'm grateful to be here today. Thank you again for asking me to be here. Next slide. So I'm going to tell you quickly a little story, a tale of two low-risk TAVR patients. So my TAVR was actually done when TAVR was allowed for high-risk only patients. There were clinical trials subsequently that went into moderate risk, low risk. So I'm going to tell you a little bit about two patients in this low-risk trial who are 20 years apart in age, Jim and Simon. Jim was 65, Simon's 84. And you might expect that they would represent vastly different patient experiences with 20 years in between them. I actually met Jim in Denver, Colorado, going on rounds with Dr. Jim Messenger, or John Messenger, sorry, at the University of Colorado Hospital, where I had my TAVR done. And we walked into Jim's room 2 or 3 hours after his heart valve replacement. It was a minimally invasive procedure, to find Jim sitting up, eating, talking with his wife. And the very first words out of his mouth when Dr. Messenger and I walked into the room were, "How soon can I get back to the gym to lift weights, Doc?" I did not expect to see that happening. It was pretty amazing how well Jim did. So fast forward a few months later, I was interviewing another patient, Simon, who's a retired professor. He was living outside of Boston, and he was 84 years old. And Simon noticed that he was having difficulty chopping wood outside of his cabin, outside of Boston. And Simon was a pretty self-advocating kind of man, and he researched treatment options and decided he wanted to participate in clinical research as a care option. And he researched treatment options, decided he wanted this minimally invasive TAVR procedure, and found a clinical trial near him, all himself. So I interviewed Simon a few months after his procedure, and he was thrilled with his experience in the trial and was actually already back to chopping wood just a few months later. Next slide. So what we've been talking about for 2 days is, how can we put patients at the heart of our studies and have truly patient-centric studies where we're measuring what's important to patients, and patients are not experiencing undue burden in participating in trials. We want the patients to have positive experiences like Jim and Simon. And so many factors go into making this happen. And I would like to suggest that involving patient advocates from the beginning can help make truly patient-centric trials a consistent reality. Next slide, please. So some ideas that I'd like to share as a potential for making this happen is, of course, starting in the study design and talking to patients, asking patients what's important to them, what are outcomes that matter to patients, and measure what matters, and involve patient advocates early on in studies. Incorporating direct feedback from patients early on when the study is just being formulated can end up saving a sponsor hundreds of thousands of dollars by avoiding a costly protocol amendment. And a story about that a colleague of mine shared was she was working in a clinical trial looking at a medication to treat hot flashes in older women. And the sponsor had developed the screening design. And with that sponsor developed design, all of the testing that needed to happen happened all in one clinic visit in one day. And that included an endometrial biopsy, which is a very invasive procedure. And the patient advocates looked at this before it actually happened and said, you know what, this is too much of an ask. This is too big of an ask for patients. And what could have happened also was patients were being asked to do all of these tests, including an endometrial biopsy, and then might discover that they're not eligible to participate in the trial. So the protocol was redesigned based on that direct input from patients, and the sponsor saved money. The patients weren't unduly burdened with an invasive test. Also, communication with the patients was improved, where they explained that FDA required the endometrial biopsy for safety reasons, and that helped the patients who did have to have the endometrial biopsy feel better about participating in that and seeing why it was important. So that is something to think
About
about
one
as
more
far as
minute.
asking patients. Okay, so I'm going to move forward then pretty quickly. Well, if we could go to the next slide. So how do we find patient advocates to do this? Because that might be a little difficult. Next slide, please. Next slide, please. So there are ways to find patients. There are PCORI ambassadors that you can go actually find them online and search yourself. Next slide, please. There's the Savvy Cooperative, which is a relatively new company that's actually a match.com of patient insights, where you can reach out to them and they can get patient advocates who can help. Next slide, please. There's WeGo Health, has over 100,000 patient advocates and influencers working to transform healthcare. Next slide, please. You can also look on social media. This is a little self-serving. This is some of my social media, but articles that I've written on health grades, blogs on my website. If you're looking for a particular type of patient or patient from a disease state, looking online can help you find advocates who are very active, and advocates are networkers. And so even if that advocate is not in the age group or something specific about it, they can probably help you get what you want and need. So next slide, please. We're to the very last one. So thank you again for inviting me to be here today. And it's a work in progress. You see the heart in construction. That's an actual photo, which is not there anymore, but it's a work in progress doing this together. And the more we focus on patients and ask patients and make their well-being the central focus, we're going to get it right. Thanks.